A typical case of a healing stress fracture in the lower margin of the tibia. People will feel it either medially or laterally, and he has the accompanying shin splints. He feels a little strain on the tendon, but you can see, if you know anything about x-rays, the fibula is on the one side, and then the arrow is pointing to where that bubble is, where the bone is thinner, and there's a little bit more swelling. That's the area of the healing stress fracture or stress reaction. The patient also has pain on his fifth metatarsal base, and looking at this, it looks a little thin, but I would call that at most a stress reaction and maybe just a bone bruise. So it's not uncommon, again, marathon training, you did a 16-mile run, to have that. So we're gonna try a treatment of something called pulsed electric magnetic field, which can heal and decrease the amount of time that it would take for him to get back to training. We are going to do some water running as well to supplement, so he's not doing nothing for the next week or two. Pain-wise, you started with a 3 on your shin sitting, and now you'd say it's kind of a 2 sitting, just sitting.
Yeah.
And then what was the kind of the bottom foot where you have the treatment right now?
That was sitting like a 5.
A 5, and then what's it feeling? What's it feeling now with the treatment, and then we'll see what it's like walking after. What is it?
As of right now, 2, 3.
It really kind of takes the throbbing down.
Yeah.
Now, and we're only walking. We got the Ultra Experience, which is a good shoe for you.
Yeah.
Yeah, definitely stiffer than the glycerin you were running in.
Yeah.
Yeah, you feel that stiffness more. And then the other deal is you've got the sleeve on, and then the other deal, we did the one PEMF treatment.
Yeah.
And you were at a 5 on the, what I call the styloid process. What does that feel like now?
In the foot or the shin?
The foot.
The foot's probably 4.
Okay, so it went down
5, yeah.
10%, 50, or 20%.
I feel like
5 to 4.
I'm walking normal.